athlete has spinal stenosis affecting the lumbar region. To minimize symptomatology, the therapist should recommend that this individual not A. Play tennis, B. Ride a bicycle, C. Perform curl-ups, D. Use a rowing machine. A. A. An occupation which requires a great deal of kneeling will be impacted the most if the diagnosis is A. Osgood-Schlatter disease, B. Plica syndrome, C. Acute prepatellar bursitis, D. iliotibial band friction syndrome. C. A. B. You are evaluating a patient with chronic obstructive pulmonary disease. You would not expect to find A. the presence of hypercapnia, B. increased total lung capacity, C. increased vital capacity, D. abnormal ventilation perfusion ratio. C. B. A. A. D. D. A patient with a transverse spinal cord injury has total lack of hip flexion, abduction and knee extension. This functional picture is consistent with the designation of a complete spinal cord lesion at the level of A. T12 per liter 1, BL2 per liter 3, CL3 per liter 4, DL4 per liter 5. A. A patient with a transverse spinal cord A. A patient presents with a red, beefy granulating wound. The dressing that would be inappropriate to apply is A. occlusive, B. wet to wet, C. hydrophilic, D. wet to dry. D. You are working with a patient who exhibits affluent aphasia. This form of aphasia is usually characterized by A. normal auditory comprehension, B. very slow speech, C. impaired reading and writing, D. impaired articulation. C. You are working with a patient. C. B. D. The most functional way to teach an individual with a T4 complete paraplegia to transfer from wheelchair to mat is by using A. stand pivot technique, B. squat pivot technique, C. sliding board, D. back out technique. B. To prevent contracture in a newly admitted 8-year-old with anterior neck burns, it would be best to position the neck in A. hyperflexion, B. slight flexion, C. neutral, D. extension. D. 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 If the patient is placed in a supine position with the head flat, postural drainage is optimal for the A. apical segments of the upper lobes, B. posterior segments of the upper lobes, C. anterior segments of the upper lobes, D. lingular segments of the left upper lobes. C. D. B. A physical therapist working in a school system wishes to examine a child with a complex medical history. The therapist should first contact the A. parents, B. teacher, C. student, D. physician. D. Damage. Damage as a result of Salter-Harris type 4 supracondylar humeral epiphyseal fracture in a young athlete will most likely result in A. refracture at a future time, B. non-union, C. arrested growth, D. severing of the radial nerve. C. B. A. You are evaluating a 48-year-old tennis player with a lower extremity problem. You would use the Thompson test to assess for A. anterolateral rotational instability of the knee, B. iliopsoas tightness, erectus femoris tightness, D. Achilles tendon rupture. D. C. A boutonniere deformity of the finger would not consist of a hyperextension of the proximal interphalangeal joint, B. overstretch of the extensor digitorum communis tendon, C. volar slippage of the lateral bands, D. hyperextension of the distal interphalangeal joint. A. B. B. Following an exercise session in a Phase 3 cardiac rehabilitation program in which some patient may experience angina pectoris, the therapist employs a gradual and prolonged cool-down period primarily to prevent A. exertional dyspnea, B. tachycardia, C. venous pooling, D. hypertension. C. As a result of a pituitary tumor affecting the optic chiasm, a patient exhibits a visual field deficit which has inhibited performance in many daily activities. The expected deficit would be A. homonymous hemianopsia, B. blindness in one eye, C. circumferential blindness, D. bitemporal hemianopsia. D. 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 C. A patient's peripheral skin color progresses from blue to white to red. This would be most characteristic of A. Chronic venous insufficiency, B. Acute venous insufficiency, C. Acute arterial insufficiency, D. Vasomotor disorders. D. B. C. The muscles that can function as synergists when acting on the scapula are the A. rhomboids and trapezius, B. rhomboids and serratus anterior, C. serratus anterior and levator scapulae, D. teres major and infraspinatus. A. D. C. As a result of diminished movement associated with Parkinson's disease, a physical therapist might employ rhythmic initiation primarily to help improve A. trunk stability and proximal tone, B. trunk rotation, C. upper extremity function, D. active and passive range of motion. B. A. When performing underwater ultrasound, the most important safety factor is that the A part being treated is not immersed in a metal tank, B. transducer head keeps moving, C. ultrasound apparatus is connected to a ground fault interruption circuit, D. piezoelectric crystal is not cracked. C. C. B. D. 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 In hospital situation, OSHA has no jurisdiction regarding A. proper grounding of electrical equipment, B. vaccination of the staff against hepatitis B, C. biohazard disposal, D. workplace access for handicapped employees. D. D. C. D. A patient with adhesive capsulitis of the glenohumeral joint should demonstrate the greatest limitation of motion when performing shoulder reflection. B. Abduction. C. Medial rotation. D. Lateral rotation. D. B. B. D. D. A. D. D. B. D. A. B. C. A. A. C. D. B. In managing the residual limb of a 72-year-old patient with a transfemoral amputation, the most important factor to consider is A. Contracture of hip musculature. B. Residual limb shape. C. Muscle atrophy. D. Residual limb healing. B. C. D. The normal and feel associated with full elbow extension can be classified as A. MTB capsular, C. Springy block, D. Bone on bone. D. A family is caring for a child with diagnosis of spina bifida. The physical therapist should write the home program assuming a familial education reading level at the A 2nd-3rd grade, B 5th-6th grade, C 8th-9th grade, D 11th-12th grade. B. The major purpose of having an incident or occurrence report system in a healthcare facility is for the purpose of A. Satisfying legal and regulatory authorities, B. Satisfying the facility's insurance carrier mandate, C. Corporate accountability, D. Risk management. D. When using a patellar tendon-bearing prosthesis, a patient will experience excessive knee flexion in early stance if the A socket is aligned too far anteriorly, B socket is aligned too far posteriorly, C foot is outset excessively, D foot is inset excessively. A. C. B. When the ankle is forcibly inverted and plantar flexed, the ligament that is most frequently disrupted is the A. deltoid, B. anterior talofibular, C. posterior talofibular, D. calcaneofibular. B. During pregnancy, the presence of the hormone relaxin can lead to abnormal movement and pain, which most frequently affect the A. glenohumeral joints, B. hip joints, C. lumbosacral joints, D. sacroiliac joints. D. Increasing the frequency of ultrasound in order to treat an ankle sprain will result in A. increased attenuation, B. decreased tissue temperature, C. decreased intensity, D. increased intensity. A. A therapist investigates the normative values for isometric force obtained with handheld dynamometers. This type of research can be categorized as A. historical, B. descriptive, C. experimental, D. quasi-experimental, using a sample of convenience. B. C. Following the reduction of development dysplasia of the hip in an infant, the physical therapist should instruct the parents to maintain the hip in a stable position of A. flexion and adduction, B. flexion and abduction, C. extension and adduction, D. extension and abduction. C. B. C. A home health physical therapist makes a list of equipment the patient will need to function in a home environment. For a homebound patient, Medicare will not reimburse for A. hospital bed, B. wheelchair, C. commode, D. home traction unit. A. You are performing sensory tests on a patient diagnosed with C6 nerve root impingement. Testing should concentrate on the A, third, fourth and fifth fingers, B, ulnar border of the hand, C, thumb and index fingers, D, medial forearm. An external shoe modification that would be appropriate for a patient exhibiting flexible subtalar valgus deformity is A, cushion heel, B, lateral sole wedge, C, medial sole wedge, D, medial heel wedge. During weight bearing, an external shoe modification that would be appropriate for a patient exhibiting flexible subtalar valgus deformity is A, cushion heel, B, lateral sole wedge, C, medial sole wedge, D, medial heel wedge. D. During weight bearing, a soft tissue contracture resulting in supination of the forefoot will be compensated for by A, pronation of the forefoot, B, pronation of the rear foot, C, supination of the rear foot, D, pronation of the forefoot and rear foot. B. When recommending a wheelchair for a patient with a lesion at T11 resulting in paraplegia, the modification least needed by a patient with this disability would be A, swing away footrests, B, high seat back, C, pneumatic tires, D, caster locks. B. You are instructing a new mother to perform range of motion and stretching on her newborn who has a clubfoot. You would advise her to carefully stretch in the direction of A, plantar flexion and inversion, B, plantar flexion and eversion, C, dorsiflexion and inversion, D, dorsiflexion and eversion. D. When having an individual perform interval training to stress the aerobic system, a work interval of 3 minutes is employed. It would be best if the rest interval equals A, 1 minute, B, 3 minutes, C, 6 minutes, D, 9 minutes. B. If TENS is used to help control pain following cesarean section, it would be best to place the electrodes A, over the lumbar paravertebral muscles, B, over the sacrum, C, at the acupuncture point just distal to the focus of the pain, D, over the lateral aspects of the incision. D. Which activity would not help? C. Which activity would not help to break up lower extremity synergy combinations in a patient with hemiplegia? A, balance training in a kneeling position, B, backward leg lifts with the knee extended on the affected side, C, bridging in the hook lying position, D, rolling from a hook lying position. C. D. 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 A patient trying to cope with his disability is going through a stage of anger. Anger would not be expressed using the mechanism of A, denial, B, projection, C, non-compliance with treatment, D, displacement. A.